this is one issue that everyone's actually affected on.
So when you hear about other countries where people are waiting for a whole year to have their surgery,
there will not be a bed for you. That's the
yes.
potential. Now, what does this mean for you? Okay, especially my rural folks, especially my suburban folks, listen in. So there's now one hospital that's going to do 3 hospitals worth of work. The building's not getting larger, the team is not getting larger, but the population that they're going to have to serve is going to get larger. Yeah.
So what other things can people start to?
A car accident, a heart attack, cancer, a newborn. Yes.
So, I'm so glad you tapped into that.
And that's in this country right now, the country that's number one.
You may want to do that math. Don't leave.
And it's your money. It's your money. You put it in. I have to adjust for this one. Okay.
Let the people know. Today, we are laying everything out and providing you the information necessary to make the best decisions when it comes to your healthcare coverage for you and your family. Reduction and elimination of federal safety nets may result in enrollees paying 2 to 3 times the prior insurance premiums. And with medical debt considered with credit score calculations, deciding whether or not to keep health insurance is the dilemma many Americans are facing. Past is prologue. We have already learned that when the number of uninsured individuals increase, healthcare premiums surge for everyone. Don't you worry, be prepared to take notes. Today we provide guidance on how to maneuver through these turbulent times. We thank you guys for watching. Don't forget to like, comment, and share. And if you really appreciate this content, make sure you hit a thanks and don't forget to do it. Click subscribe. So a lot of people are very nervous about 2026 because they feel like potentially they may be losing their insurance. Mm-hmm. And this has caught a lot of attention, especially for those who are insured on the Medicaid. Now, a lot of people are not quite sure what the changes are, and there are still some Americans who don't even know that changes are coming. So today we're excited to really have this conversation because we feel that we can make an impact with sharing what the cuts are, what are coming, and the things that you should know to protect and make the best decisions for you and your family. So one of the things that we want everyone to know is that there is a large percentage of Americans who are insured on the Medicaid. So it's estimated that 1 in 5 Americans are insured on the Medicaid. And when you go into rural communities, that number increases closer to 1 in 4 Americans. In fact, the 2024 statistics are showing that nationwide, the number of enrollees may be as close as 26%. So this has caused a lot of panic, and now is the time where people are really starting to make decisions about their insurance. So you guys, I had to bring one of the best to our virtual couch. Yeah. I'm so excited to have Pashay Bryant with us today, who is the founder of My Maternity. This is what she does all day, every day. So I'm so excited to have her join the couch with us to share some knowledge, drop some pearls, and get us right with our insurance. Pashay, I'm so excited to have you here.
Thank you. Thank you. Thank you. Thank you. I'm excited to be here, but my goodness, what an introduction. Like, I love it.
That's how we do. That's how we do. We celebrate people for what they do. So I'm super excited. And I know you have lots of thoughts about this because you have been in the trenches helping people and helping people navigate. But let me ask you first, what were your thoughts when you heard about the cuts that were coming?
Yeah, I will say that I was very concerned because there's so many effects that happen, and it's not just for those who are reliant on Medicaid, but even those within the commercial space who thought that they wouldn't be impacted. And so I could see the bigger picture of how it's really going to have a trickle down effect. And so I was very much part of the activism side of things to keep Medicaid. Unfortunately, we lost that fight, but as they always say, you would lose a battle, or you lose a battle, but maybe
not the war.
Mm-hmm. So the fight continues for sure.
Why is this so important to you? Why is being an activist in this space important for you?
It's important for me because these are people's lives. It's not just a dollar. When I spoke about it and I was giving speeches, I was talking about how Medicaid is a financial assistance resource for families. And so, especially because I work within the maternity space, but I see it all over with our senior citizens and I see it even with our independent folks. But especially for families, it's one less thing that you have to worry about if something happens to you or something happens to your loved one or your child. And it is a financial resource to know that if I go in and I need care, it's taken care of, right? I have that assistance, and then I can focus on everything else that a person has to focus on. So that's why I matter, or why it matters to me, and why I care so much.
Yeah, you're absolutely right because we know that that medical debt is one of the top causes for why people go into bankruptcy. So it is about the well-being and the welfare of individuals. And we almost got medical debt removed from the credit report. We'll get back to that. We'll get back to that, hopefully, because I thought that that was a great initiative
I did.
because, financial wellness is really tied to someone's health care and someone's health and well-being. So it's more than just your finances. It's how you feel about your finances, whether you're stressing, whether you're anxious, whether you're depressed.
Yeah.
And to have something such as someone's health care be the source of their anxiety is really unfortunate, right? Because it seems like such a basic right for everyone that everyone should have access to healthcare without the anxiety of not being able to afford healthcare. Healthcare really should not be something that's elitist,
Yeah,
something
or
that's such
privilege.
right, exactly. Something that's such basic rights. And so as we all know, these cuts came from the passing of the one big, beautiful, people have other acronyms for it, bill.
Yes. I didn't think that's the
And
name. So, yes, go on.
I've heard just a varied of acronyms. Some of them are some of my favorite that I cannot repeat on this platform. But our creatives are doing what they do. So what are some of the things that you have heard that are changing with regards to requirements for the Medicaid program and for enrollment? Anything you want people to really be aware of?
Absolutely. So there are two sides, or 2 points that I really want us to highlight. It's one is there's now going to be a work requirement. And so previously, one of the qualifications of getting Medicaid would be if you lost your job. So if you lost your job as a qualifying life event to get Medicaid, maybe, mid-year enrollment. But now they're requiring at least 80 hours a month. So that's approximately 20 hours a week. So give or take, 4 hours here and there. But where you have to be working, you have to be volunteering. And so that is one huge change. The second is that it's no longer where you apply, you are accepted, and now you have a year until you have to re-enroll. Now it's looking like every 6 months that you need to re-enroll. And it's really important because you don't want to miss that deadline. You need to meet that deadline to make sure that you put in the paperwork and then you actually get re-accepted so you have continued care for the other remaining 6 months. So those are the two that I would say people really need to pay attention to when it comes to the details, because it's going to require more paperwork and more deadlines.
Yes. And please understand, I'm glad you highlighted those particular changes, because please understand that they're intended to create barriers so that fewer people will be able to keep up with the demands and the paperwork or be able to meet the needs. Because if you think about a mom who has been laid off and she has several kids that she's caring for, just even the realistic expectation of 80 hours is a lot for certain families, and in some cases, probably unrealistic, especially those who are caretaking for kids with special needs and things like that. And yeah, I will say overall, they're making fewer exemptions available for individuals. So there definitely, I would recommend that everyone kind of look at the list of exemptions, and just as Pache mentioned, look at the list of qualifying activities. So they're going to require you either to be working, to do some type of job training, not working, but some type of job training activity. The,
School counts.
go ahead, say that again.
School counts.
School
There's
counts,
yeah.
yes, exactly. So if you're in school, if you're in, which falls under the educational program option, if you are participating in community service, or you can do a combination, is my understanding, you can do a combination of those categories to meet the 80-hour requirement per month. But definitely check into where the exemptions are, because if you've been exempt before or was able to apply for a waiver, that may not be the case now. And we're talking a lot of Americans, right? So the Congressional Budget Office estimates that about 11.8 million Americans could lose Medicaid by the year of 2034. That's a lot of people.
That's a lot of people, and it really kind of determines if people are going to go the commercial route and enter the marketplace insurance, or if they're just going to decide I'm not going to have insurance. And
But
I fear that latter option of a lot of individuals just saying, well, I'm not going to bother, or I can't afford it. So even if I wanted it to get health insurance, I can't afford $200 a month on top of what I'm already paying, with the salary that I'm paying that we already know is not increasing at the rate that inflation and life expenses are. So,
absolutely, absolutely. And the ballooning effect, right? So the if we don't get renewal of those tax credits with the Affordable Care Act, it is anticipated that some premiums could be doubled or tripled. And people are starting to receive notifications
yes,
as to what their potential estimated premiums can be moving forward from next year.
Today, my job released our open enrollment. It started today. I am currently paying $240 every 2 weeks for health insurance for a family, correct? Now, that does not include my vision, dental, 401k, or disability. So when you add all of those in, I'm paying about $550 every 2 weeks for my entire family to have medical, dental, vision. I have disability coverage, and I also contribute to my 401k. We just got our benefits for next year. What I'm currently paying $240 every 2 weeks for is going up to $709 every 2 weeks. That does not include my 401k, my vision, my dental, my disability insurance. How can I possibly survive paying $1,500 just in medical coverage? They already kicked our spouses off of our coverage because they said if your spouse can get insurance through their job, we're cutting them off. So not only did you cut them out, it tripled. $700 just for medical benefits every 2 weeks. I'm not even talking about a month. This is bi-weekly. How is this? And I work in medical.
From next year. So I completely agree with you that there is a potential for individuals to decide that they're just not going to be insured. And I talked about this on a previous video, what that ultimately leads to and how it affects our healthcare system and how it drains the emergency room, how it drains
yes,
emergency services, how it increases the risk for adverse outcomes, uncontrolled chronic diseases, which then leads to a high mortality rate, high morbidity rate. We're not going to go into that on this conversation because we got other things we want to talk about. But definitely know that these changes actually have very much unfortunate health outcomes. And so we're talking about healthcare deteriorating. If anything, I would say this is a Make America Sicker bill as opposed to a Make America Healthier initiative. And so unfortunately, we're kind of bracing ourselves for that. And I also mentioned on another talk, just the impact on access. So how this, you want to mention share about that? What are your thoughts about access? Because that's something people are thinking about their individual costs and what they may have to pay out of pocket and how it's going to impact them individually. But as communities, what should we be thinking about?
Absolutely want to answer that. But before we go too far away from that really great topic that we just left on,
Mm-hmm.
I want I want employees to also know that, and I see it because I hear and work with employers and companies, that
Mm-hmm.
their premiums that they're, signing up for are increasing, which has a trickle down effect. So I really, really want people to understand that this isn't just those on government programs. Oh, it's a government program, it doesn't bother me. No, no, no. This is trickling down to employers now signing up with the insurance companies for higher premiums, which means that that premium that you pay for, that's for yourself or your family, which we know family premiums tend to be higher anyways from the
Mm-hmm.
individual. They are expecting to potentially double. And in some cases where it's already a poor plan, potentially triple. So I want all individuals to know that this is one issue that everyone's actually affected on. It's
Yes,
just
we're all
them
going to feel
versus
it.
us.
We are definitely all going to feel this change.
Yeah.
Yeah, except for the top 1%. Because,
Yeah, but they're 1%. So
yeah, exactly. The top
like,
1%, because this was intended to benefit them. Keep that in mind. But everyone else, the 99% of us, will be feeling it collectively. But yeah, and in terms of community, also, we're going to feel the effects of this, and this is going to affect communities. What are you hearing so far about how these changes are potentially affecting communities?
definitely. So I'm hearing, so from, I would say, when I talk to leadership and local government representatives, they're worried about the effects on the community as far as their residents, their individuals that they serve no longer having access to care, or some of their hospitals, when I talk to those who are from more rural areas or suburban areas, their hospitals are closing down or talking about closing down. But I always like to say I see hope in everything. The one area I will say is our providers are really coming together as much as they can, and so
Mhm.
they're finding ways to provide group access potentially to visits, when to allow one maybe a lower payment for the group, so they can see a multitude of different people at a lower rate. And then they're still getting that care that they need from the community side of things. But I will say that the community
I
also,
want you to explain that a little bit more. What exactly are doctors doing?
yes, yes. So doctors are coming together and they're providing group sessions, a group care session. So if you need to see an OB, they're offering a way to where they can see maybe 5 individuals within a group setting. They can talk about what they need to talk about, and then they can pull each individual off for an individual session within that time frame. Um,
Yes.
and then chiropractors, I'm seeing chiropractors get together and do a group session. So they're adjusting individuals, and you're kind of just waiting in a line, or you're just waiting in the space that's available. I'm seeing it for acupuncturists. I'm seeing it for doulas. I'm seeing it for midwives. Like,
Mhm.
the community is coming together to make sure that there's still a way to have care without them also, well, they're a business, right? And they also have families. So that's like that interesting balance between like providing care and then also recognizing that unfortunately in this country, it really does cost to provide care.
Yeah. And it's interesting to hear that other specialties are exploring that model because that model really was birthed out of women's health. And when I say birth, I mean that intentionally. So that's a model that was actually starting to be explored through ACOG, where individuals who were lower risk pregnancies can come for shared appointments. And it really allowed the clientele to be able to actively participate in their own medical assessments. So they will do their own blood pressure, sometimes their own temperatures, do their own weight measurements. And those appointments, I mean, I definitely think that there is value to those appointments, especially in this workspace that we're in now, or in this new healthcare policy space that we're in. There are some challenges to that model. But I can definitely see it being a solution in this healthcare or the rollouts of these changes that we're experiencing. And you're absolutely right that we do have to be innovative, and we can be innovative to come up with ways of kind of navigating around these changes. There's some people who are considering that the cash payments for visits may increase. So being
Mhm.
able to, at least, you may not be able to get all the things that you're looking for in turn that you would ordinarily get, and hopefully preventive services will not be touched. But that's something
Oh,
we're
please,
also watching, right?
please, yes, we're
Because
watching
if
heavily.
we lose the access to what's considered to be preventive, or what's or whether or not preventive services will continue to be um continue to be without additional cost to the individual, that
Yes,
are covered for everyone. If that is in some way changed, then we're really in some deep trouble. Because that's really how a lot of clientele who are financially limited get some type of management and screening for chronic diseases, and allows us the opportunity to intervene with lifestyle changes, even if we're not able to do the big medical management otherwise.
yes,
So
and
that's really,
mhm,
if we had something to fight for, definitely make sure we fight for keeping preventive services,
that's right.
because and what is considered to be preventive based on science.
Yeah,
That's the other, they may keep preventive services, but change what they think should be prevented,
right.
and not use the science. So we know things like breast cancer, like screenings for colon cancer, screening for prostate cancer. We know screenings for diabetes and cholesterol levels help to prevent heart disease. So
Prenatal visits.
right. So if they change those definition or those criteria, we're in some serious doo-doo.
And I
But
will say, as somebody who works with individuals looking at
uh,
their insurance plan and working with providers to see how I can get the, the proper codes for them to, actually have their visits be covered under preventive. So it supports their clientele. The list is already so stringent for what's considered preventive. If it goes even more so beyond that, or it gets taken away more so beyond that, I don't know what we're working with. We're working with the string with no beans. Like
yes.
it's
That's a
already,
great analogy.
yeah, that's what we're
Yeah,
looking at. So
absolutely. You're absolutely right. You are absolutely correct in terms of, we're already seeing some of the changes in
yes.
communities. We're already seeing closures. Listen, I personally just found out yesterday that the pediatric inpatient unit for the hospital I'm at
Uh-huh.
is closing. So we're already starting to see some of the consequences of these cuts, just from the hospitals anticipating, everybody's crunching numbers, and they're anticipating how these potential changes will impact the community around them and their ability to continue to service that community. And this is coming on the heels of one of the major research hospitals for children in the entire nation
Wow.
already having cuts. So our patient population can't even say, well, they're going to be relocated to that hospital, because that hospital already had a significant cut of employees. And so
Oh,
it just really limits, it's already limiting the access to healthcare, and it's going to overwhelm the one higher level institution in the community. And what happens when there's a bottlenecking of higher volume going to one hospital, that hospital will become overwhelmed, and it does impact the quality of care,
it has to.
right?
Yeah.
The burnout level.
Absolutely. And then on top of that, we're already seeing, news reports and just individuals within the provider community saying that they're striking, or that they're,
Yes.
they're going, or they're preparing to strike because of their rates being cut. I was just looking at nurse anesthesiologist, and
Oh,
their rate
yes.
15% being cut, which is what heavily rural suburban communities rely on for that individual providing that service. And so
Yes. Because they fill the gap of anesthesiologists. Yeah.
We do. And
Yes.
so it's just absolutely shocking as far as again that trickle down effect of where it's just spreading. For
Yes.
instance, I believe it was, man, I wish I could remember which state it was, but there was one state in one city area where they had 3 hospitals servicing the population, and they've already cut down 2 of those. So there's now one hospital that's going to do 3 hospitals worth of work. The building's not getting larger, the team is not getting larger, but the population that they're going to have to serve is going to get larger.
And what that means, what Pache is saying, is
Yes.
longer wait times. So when you hear about other countries where people are waiting for a whole year to have their surgery because of the long wait, that's what that means. That's what that turns into. Not having bed access, being in labor in the hallway.
Yes. So
I've
I
seen it.
really hope you bring your doula or you
Yeah.
start getting trained in some techniques to help you go through that because that's absolutely going to
Not being able to have a maternity bed is very real there. I have seen it in
be
my life, in my career life. I have definitely had been at institutions where I cannot name, but I've been at institutions where that was a thing, very much a thing.
because we hear so much about how great the US is, and I absolutely have nothing to go against that. I love my country.
Mhm.
I will also say that we're not talking about a second world country. We're not talking about a third world country. We're talking about our home right now.
That
You may
point,
not have a bed if you go into the hospital for care. And it
that
doesn't matter
point.
if you're going for because you're pregnant or if you're having a heart attack or you're going because you're having crazy pains and maybe there's something going on with, your pancreas. There will not be a bed for you. That's the
Yes,
potential. And that's in this
yes,
country right now, the country that is
right,
number one economically.
right.
So just
That says a lot. That says a lot. I like the fact that you already had a solution right there when you said make sure you get a doula
I'm
because if
I'm
you can't
solution
get a
oriented.
bed, right? Because if you can't get a
Yes.
bed and you have your doula at your bedside, you can still kind of reserve the type of birthing experience you're having.
Yeah.
So what other things can people start to think about as they're preparing and bracing themselves for this potential drastic change through their finances and to their health access?
Yes, I think we need to start having a real conversation about what it means to budget in homes now. We always talk about, we talk about budgets, and it seems like it's something where for emergency fund now, but now it's like I think really families, including my own, right? You see my background, families need to begin planning for if this illness comes up, and it can be as simple as the flu and you needing to go into the urgent care, and Lord forbid your urgent care closes at 9 p.m, so now you have to go to the emergency room. I need you to know what the cost is going to be, and that's why for my maternity we provide insurance check reports so people can know in simple plain language, because sometimes it can get very cryptic,
Mm-hmm.
what it is and how much you potentially could cost if you seek out this service. But you've got to know these things. So I really want people to start one planning, putting some money aside for that in case of, because your plans are going to change. The coverage is potentially going to change. And from what we're hearing from insurance companies already, it's going to lessen. So it's not going to be the other way around. For the most part, take a look at
Mm-hmm.
your plan. And then second is I need people to start knowing what their plan actually covers and doesn't cover. So when you get your summary of benefits, when you get your evidence of care, I need you to take a look at it. And if it's confusing for you, find someone like myself, a third party, or your own insurance company, or the hospital, somebody who can explain it to you of what it is that you have, because you need to know.
Mm-hmm. 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 And you were mentioning, I like the point of being aware and informed of what you're paying for, which, a lot of us, we sign up for insurance and we just kind of look at the major things, right? Like what's my copay, what's my deductible,
Yep.
what's my premium, and it's like check, 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 and that's it. And we don't really look at the details of it. When you're talking about finding out what something costs, how do we get access to that information? How do we find out what's the cost of getting my foot exam with a podiatrist if I'm diabetic? How do we find out that type of information?
So that's where that's the reason I created my company because
You could go
um,
ahead and promote your company.
because it is tricky. It is meant to be difficult.
Mhm.
And so, but I always want people to feel empowered to do their own research. So, what I will say is, you can always call in. The members might not be able to provide you the answer. So, if you feel like you didn't get the correct answer, look at those two documents I stated: your summary of benefits, your evidence of care. If that's too confusing for you, and because again, it's not your fault, it is meant to be confusing. And in some services, like especially maternity services, they're hidden under other areas because it wasn't actually recognized within the space. So that's one area that we're hugely addressing.
Oh, if you're gonna go there, touch on that.
Ah,
What do you
okay,
by that?
I will. I have to adjust for this one. Okay.
Let the
So
people know.
okay, I read every day. Like she said, this is my world. I read insurance claims, insurance reports, documents all day, every day. And if you look at your summary of benefits, like I was mentioning, and you say, "Ah, what are my breastfeeding benefits? What are my lactation consultation benefits?" They're not listed. If you ask, what are my doula benefits? They're not listed. If you're asking, what's my pelvic floor therapist benefits? Which is now, I highly recommend it, postpartum and even prenatal care option, right, to support with labor preparation as well as labor, recovery. But it's not listed. It's under maybe physical therapy or rehabilitative therapy, but it's covered up somewhere else. If you want to know what your nutritionist options are to support with milk supply or to help you recover postpartum wise, it's just they're not listed. They're not listed there. So all these amazing maternity providers are not listed because they were not recognized providers before, and especially doulas until 2023. And that was just within the testing, piloting Medicaid space. Okay. Now in 2025, now the commercial space is opening up to these providers. So this year, we're in 2025 right now. Just this year, they're opening the space up to lactation consultants, being independent IBCLCs or CLEs, without having to be under someone. We're seeing doulas now being recognized as providers, and just the list goes on. Pelvic floor therapists now being potentially considered preventative in some areas. Again, we're all working within the scope of this, but
Mhm.
there's they weren't recognized providers, and so now, and don't even let me get started with fertility and menopause. That's a
Yeah,
whole other
yeah.
conversation.
Hmm.
But they're now being forced to, they meaning these insurance companies and benefit administrators, are being forced to recognize because the need for this, the demand has increased beyond what they would have ever expected.
Right.
Health is coming into power. So,
That's super helpful because I do think that that's an area of confusion because it's intentionally like the way the system is made, it's intentional so that you underutilize services, so that insurance companies don't have to pay as much. So that's a whole other conversation. But also because Medicaid is a federal program, there are some caveats with states, right? So help us. Part of the confusion also is people understanding what is a state law, what is a federal law, how the state and the feds work together with this particular health program. Can you explain and share with any resources that individuals should seek out if there's really trying to understand what the state is providing, what the feds are providing, and things like that?
yes. Okay. So there absolutely is a difference between the federal programs that may be available and then state programs. So, one, I want that to be potentially a point of relief, even if you hear everything going on with the federal government. Now, here's the biggest part though. See, for California, for instance, a state that has its own economy that can live off of,
Mhm. One of
federal
the largest in the entire world.
Did you hear that?
Yes.
True.
I think it's
Um,
number 4. If
she's,
I'm
yes, we are.
Yes.
California is a country, economically, right? But so the federal funding isn't as significant as, let's say, another state, maybe a southern based state, where it is a significant part of what they're able to fund as far as their programs. And so, how the money trickles down is that the federal government at one point was even matching what maybe a state was contributing, saying, okay, if you're going to invest in your people this much, then we'll also invest this much in them. With the
Mhm.
cuts now happening, it's really, really, really being reliant on what the states are willing to invest in you. So if your state, I won't name any names, but there are many, didn't believe in maternity leave to begin with, or didn't believe in family protected leave to begin with, or didn't believe in, preventative measures to begin with, then there's a very high chance that they're not going to be investing the little money that they now have as a state, right, alone, that they're going to put into that. Um, and so that's where that community part that we were talking about really is coming into play, where we're seeing nonprofits now show up stronger than ever, trying to fill in these gaps. And then again, the provider community trying to lend whatever much they can to extend their coverage. But again, it takes more than them. It really takes the government support to some level to help balance it out.
Yeah, and to add to what you're sharing, people need to understand how much this really does impact their direct health and access,
Yeah.
because the Affordable Care Act allowed for certain expansions of Medicaid, but
Yes.
not every state adopted those expansions.
Yeah.
And when you, ironically, when you look at the list of states, which we will not name, but you can certainly search for them,
It's public.
when right. Right. When you look at the list of states that decided not to expand or to adapt the Affordable Care Act expansion, otherwise known as Obamacare, for those who are like, what is she talking about?
Yeah.
You can see the mirroring of that when you look at the list of states that have some of the worst healthcare outcomes, the states that are less likely to expand the Affordable Care Act and thus increase access to healthcare are also some of the states with some of the worst healthcare outcomes. And so it really does matter. And access to healthcare, I don't know how many times we need to say it, access really does matter when it comes to the health of individuals, the well-being of individuals, and literally the survival of individuals.
Let alone the peace of mind.
Exactly.
You're not going to
Exactly.
go into a hole all because life happened.
Right.
A car accident, a heart attack, cancer, a newborn life.
Will
These
continue to life. Life will always be lifing.
yeah, life will continue to life, but where are the protections now to help you when life lives? This is an interesting conversation, but yes.
Yes, no, it's very real. And these are the things that people really need to think about. The whole reason we're doing this conversation and taking out time from our own personal life and our families is because it's such a critical conversation to have. And this is the time that people are starting to have these thoughts and planning and shock value when they see the insurance premium estimates for the upcoming year. It's really important for people to understand what this actually means and the potential outcomes we can be looking at. Access to healthcare and access in terms of not just health insurance, but also having access to a neighboring hospital, nearby hospital, can mean the difference of someone surviving a heart attack and someone not surviving a heart attack.
Yeah, oh, absolutely. Every
Yeah,
second matters. When I talk to
absolutely.
EMTs, every second matters from when they can get you, and that's why they move so quickly when they can get you and get you in the ambulatory truck, and then just move you along into the process. So every second matters, and if you're now, you have one less area, hospital,
Hmm.
patient, clinic
Hmm.
that you can go to for care. you've Again, what can you do? You've got to start creating a plan B. Like, do you
Right.
Do you have a doctor in the area that if something really, really, really was to go down, that you could, rely on or call or something of that nature? Start
Right,
creating your own communities now, because an hour's drive, when you feel the urge to push, you
right,
have to pull over, is all I'm
right,
saying. Um,
right.
so
And this also
those,
translates into your workforce, right? So a lot of these hospitals, if they close or if they lose certain services, they can no longer qualify as training programs, as training hospitals. So then you have fewer hospitals that can meet the qualifications in order to train individuals, and the access to
yeah,
programs that are training programs has already been an issue, especially in certain specialties. As we mentioned, anesthesiology is one of those specialties that's looking at a mass exodus because of the changes that are happening in terms of reimbursement and just the high burnout rate, the high litigious nature of the profession. OB is already in a shortage.
it
Uh,
happened for a while.
yes.
This is
And
no
this is just
surprise.
going to magnify this, right?
It is.
Which is why, the profession has been really looking at expanding the access to, I would love to make it seem like everyone really understands the value of doulas and midwives from a humanitarian perspective, but honestly, a lot of the push is from a business perspective because
Mhm.
they do realize that OBs are short, that there's a shortage of OBs, and
Yes.
they're looking for ways to fill the gaps with a number of other specialties and clinicians, including your nurse practitioner,
Yes.
including the physician assistant. That's why you're seeing some of the deregulation of what they can do and what they cannot do. They're removing some of those
Yes.
barriers because they want to utilize
Supervised,
these professions.
unsupervised.
Yeah, and we know that it's not from a humanitarian perspective. Like people don't really truly get why it's important to care for moms, unfortunately, because you can see it in other aspects in how we manage women's health. So
Yes.
understand that there's a lot of finances that are driving some of the changes that you see, and we still have to continue to work on making sure that people understand that it's valuable to care for moms, that it's valuable to care for the women who bring life into this world, who put their lives on the line and sacrifice so much of their life so that we can have these beautiful human beings walking around this earth, y'all.
Absolutely.
Okay. So,
And
so
yes.
yes,
And I want to just add to the fire, add to the flame. Um, Absolutely, especially when it comes to our OBs. They have been, I believe, but they can tell you, she can tell you, underpaid, underappreciated, undertrained, under resourced for way too long.
yes.
And now it's to the point where, and this is again a 10-year trajectory. So we've had 10 years to figure this out by now, but a decline in our OBs. So even with, listen to me, folks, listen to me, even with the decline in birth rate that we hear about for the
Hmm.
US, we still do not have enough OBs to service the population that we have right now who's birthing. And so
Right.
what we're seeing now are, again, those alternative providers now being recognized or being able to practice independently. Now, what does this mean for you? Okay, especially my rural folks, especially my suburban folks, listen in. It means a couple things. One, your insurance provider may now have to cover your midwifery cost because there is no alternative in network provider that you could seek. There's no OB within a reasonable range that you can see. So our certified midwives are now certified professional midwives are now being reimbursed at the equal level as our certified nurse midwives. This is
Talk
very
about it.
this is very, very important. Okay. This is important because now your folks who are able to see you in your home, in your space of care, part of that holistic alternative community that we heard so much about, aka that we're going. It's interesting how we're being innovative, but it's actually going back to our origins, our foundation. That's a whole other conversation.
Yes.
But
Yes.
yes. But now they're being recognized. So now you are going to be able to have more access to these individuals who once weren't, again, recognized within the hospital space, weren't recognized within the insurance space. So take a look at what that is and be sure to advocate for yourself. If you don't have an OB in 50-mile range, I need you to be calling your insurance company and asking for a way to get access to a reimbursement for a midwife, and they are responsible for doing so.
Oh, Pache, I'm so glad you made that point because a lot of people don't realize that they have community pull and power, right?
Yes.
So, oh, I'm so glad you tapped into that. I'm a just join you in that conversation because one of the things people don't realize is you can collectively demand things from your insurance company. Listen, we are all paying those extremely high premiums, right?
Yes.
Whether through employment or directly or self-employment. You can demand as a community and say, hey, we need a nephrologist in this community
Yes.
because we have this percentage of of the population that has kidney disease or is at risk for kidney disease. You can say, hey, I'm paying you all this money. I need you to make sure I have access to a doula. Get me a doula in this area. That way they can strategize. Listen, these insurance companies are making bank every year. They have the ability to make these shifts and make certain populations attractive to clinicians so that they would be incentivized
Yes.
to travel or to become a part of a new community. So you can, if you guys all agree and you have like a mommy group and y'all want a pelvic floor physical therapist,
Yes.
all of you keep calling up that insurance plan and demanding that that specialty become existent in your community. So we have a lot more power than we understand when it comes to demanding insurance companies to make certain services available in our community, especially if we have the numbers to show for it. And listen, everybody have the numbers when it comes to maternity health. So definitely, I'm glad that you brought up that point. Here's my thought though. Some people are going to do these calculations. They're going to look at the cost of their education, their groceries, because the price of eggs is still egg pricing, right? And if
Yeah.
it's not eggs, it's the paper towel. If it's not the paper towel, it's the water.
It's
So
the
we are
toothpaste.
still
It's the.
toothpaste,
It's gonna
go
be
down the
something.
list, right? And some people are going to decide, as you mentioned earlier, and I don't want to miss the opportunity to bring up that point, people are going to decide not to be insured.
Yes.
Now, what
Let's talk about it.
consequences or what precautions would you share with someone who's really considering not being insured?
Okay. I actually thought about this during our conversation. I mean, I've been thinking about it larger scope, but just for our conversation, something that you can take away. If you know you're going to be someone, I'm not going to opt in for the insurance because I can't afford XYZ, then I need you to start setting aside mentally and then actually money for that what if situation that might happen. Because you still, for your overall health, you're still going to want to get a dental cleaning, because it's amazing how much your teeth can actually affect your overall health. But if you're like, that's even too specific for me, then think about if you're going to at least see your annual, are you at least going to get your annual visit? If you're not going to get an annual visit, then uh, what's the what if situation that will cause you to go in? Is it a broken bone? Is it a car accident? What is it? And then estimate how much you need for that situation. Because again, you're going to be paying out of pocket prices for this because you don't have health insurance. Now, this is one thing I really want you to pay attention to. When there was federal funding to help support hospitals, they were able to have charity programs, they were able to have hospital bill forgiveness programs. With their funding being decreased and sometimes, and for some, eliminated completely, those programs are going to go away. So that little wiggle room that you had where you can negotiate your bill from 16,000 to maybe 4,000, or creating a payment plan option with the hospital or your clinician, or clinical area, those options are going to potentially be minimized. So there's going to be less flexibility for you to work with. Now, again, our nonprofits are really coming through. People are seeing this. So, look, there are nonprofits already that exist that help with hospital bill forgiveness or helping pay for hospital bills. And then there are also, so keep that in mind if you go into something, and they can maybe help reduce it somewhat. And then you need to have some money set aside because, as we talked about earlier on, there was a potential where your hospital medical debt wasn't going to affect your credit and wasn't going to affect having collections come after you and it be recorded on your records. Now that's a gray area. So what that means is having a life event, like we said, life still be lifing, having
Hmm.
a life event could very much affect even the bigger picture of rent applications, mortgage applications, because that debt is now going to be still attached to you until they say it's not. We haven't passed that area yet. So if you can't think about the bigger picture because you're just trying to survive, and I understand, then do whatever you can to either find the nonprofits who will support you or start setting money aside now, or always try to negotiate if something does happen. See how you can negotiate with a payment plan or something. So, again, you're not going straight to collections. For those who say, I'm not going to do anything, just know that there's a lot more there's a lot more at stake, unfortunately.
Right, right. I love that advice. And I would definitely say if you're trying to figure out, well, how much should I anticipate saving? If for those of you who have still some of your itemized bills, those bills, those statements that you get that says this is an explanation, not a bill,
Yeah.
start looking at the actual cost of things, right? Normally we get them, we see the insurance paid and we toss them to the side, or some of us may file them away just in case. Pull that stuff out. Take a look at the itemized costs of the services you received, including the labs. Because I tell you, if the
Labs.
provider don't get you, the laboratory sometimes will suck you in the punch you in the stomach, okay? Because those
Absolutely.
lab costs, whether it's their overall procedure costs or the actual laboratory costs, there's so many layers to even just a lab cost. You want to make sure that you are able to have some type of knowledge as to what these services actually cost. And the other thing that you can do is some clinics, especially federally funded clinics and lookalikes, while they still exist,
They still
let's
exist.
not give them much ideas, right? Let's not give them any more ideas before they get rid of those two. But while they still exist, a lot of these clinics also have slide and scale services. So they may have a reduced fee for the laboratory services depending on your income. So they will look at your income and then see what you can actually afford. And that option may be expanding now that we're looking at these potential cuts and the increase in Americans that may not have insurance. So really looking at your neighborhood clinics, finding out, do they have a slide and scale program? What does that slide and scale program look like? Think about the services you've received in the last year, the services you will likely need coming up, and just starting to ask them, well, what would be the cost of that? Can I get an assessment based on my income as to what the cost will be to have a follow-up appointment for my diabetic management, to have a new OB appointment? What would that cost out of pocket? Things like that, so that you can start to get some estimates, as Pache mentioned, to really start to save up for next year. So we are not going to Dubai for the holidays, y'all. We're going to be saving for healthcare because
And
Dubai could wait, okay? Unless you're going for your healthcare in other countries. Now, that's another conversation.
that's a whole nother conversation. That's where we hear
Oh,
about medical
so we,
vacations,
yeah, so
people.
we're gonna hold on that
We
conversation. We're
are.
gonna tap back into that because maybe that's what a lot of Americans are gonna do,
Yes.
depending what the cost of traveling is and that all the other stuff that's
And the
happening.
traveling of cost, that's a whole other industry, mind you, and they are
Right.
in need of people right now. So I'm just saying,
And if they see that there's an increased need, they may be a little vultures. So be careful with a lot of that stuff. And also,
yes,
as I mentioned before on other conversations, be careful who owns your data. And
yes,
be careful the incentive of them owning your data. If they're not necessarily the friendliest relationship with America, your data may become ammunition and leverage. Okay, so keep that in mind. But also to tap into one more thing, and I'm not trying
oh,
to
I have a message for our employed folks though, first, before we hop over.
Okay, so the one last thing before we
Uh-huh.
get into your tip, because we can't keep Pesci. Pesci has a family, y'all. We can't keep her all day.
I love being here though.
No, we would love to because she has some great tips. But one more thing, and I'm not trying to mess up my colleagues out there. So to my colleagues, please forgive me for saying this. It's coming from a humanitarian philanthropic purpose. But you may to get your physical exam done before the end of the year. You may want to book that. So at least it gives you another year leverage before you would have to start to look into dealing with that as a potential cost. So you may want to book your mammogram now. You may want to get all that stuff done
That's my
while
advice.
you have a few months to the year. You keep in mind that towards the end of the year is the holidays, so a lot of clinicians are not trying to see you in the clinic. As much as we love y'all and we care for y'all and we love doing what we do, we have families too. We want to be with our families. So if you want to get in and get your stuff done, and like Pache said, get your cleaning done, you may want to book now.
Absolutely. And especially, that's quite literally, so I don't have to say much other than that because she took it away. But the one little extra bit is if you know that you've already hit your deductible, and if you don't know, look into it. So look to see if you've hit your deductible already. My folks, I look at this all day long, and people have hit their out of pocket max and don't even know it, which means your insurance coverage company is responsible for 100% of covered cost after you hit your out of pocket max. And I see it every day where people, especially in my birthing community, where you're already hitting your out of pocket max. So look at your deductible, look at your out of pocket max. If you've hit one of those, you need to start getting care. You need to start getting care for the things that if you have a
Listen,
lump that you haven't been looking at yet, look at it within this plan because I can't promise the next plan period and what that, your coverage will entail. But right now, it's beyond everything that's been happening politically. So get, like she said, get your mammogram done.
mhm.
Get the care that you need. Get the fertility planning, the planning care that whatever it is for that you want to get cared. Do it within this season because I cannot promise what your plan's going to look like next season.
Listen, we give y'all a whole lot of tips. I hope you are taking notes because we are laying down a game plan to keep you healthy. And listen, we haven't mentioned HSA, but we're going to tap into that on another conversation. If
Well,
you have some funds sitting there, don't let those funds go.
yeah,
Make sure you
especially your
utilize those
FSA.
funds.
Not
Yes,
everybody has a rollover. Not everybody has a
exactly.
grace
Let
period.
them know. Let them
It's
know.
a use it or lose it.
Don't
And
leave
it's
that
your
money.
money. It's your money. You put it in. Every paycheck,
Listen,
you
if
put it
I
in.
had money left over in my FSA, I'm gonna think about stuff I never thought about to get done.
Yes. Like you need that little ring that tells you how you slept. Get it.
Yes.
you need
Listen,
you need
I'm gonna get
another
my
breast
ring.
pump.
I'm gonna get my
Get it.
Fitbit.
You need a
Listen,
Fitbit. You need a new breast pump because the other one's not charging right. I
I'm
don't
gonna
know
go to
what you need.
podiatrist, have them custom fit my feet if I have money left over in my FSA.
Yes. You need some vitamins.
See me
Oh my
walking around
goodness.
with
You need
all.
a sleep pillow.
Listen,
What do you need? You need a
yes, get
back warmer?
yourself. Listen, I'm gonna have a personal over the counter shelf in my house. Get on my Tylenol, my yes, and we still believe Tylenol, so that's a whole other conversation. It will get my Tylenol, get my NSAIDs, get my allergy medications. Look at the
Yes.
expiration date. Make sure I'm set for. Listen, we are giving y'all some serious tips.
Yes.
Anyway, we're not going to hold you guys much longer. One more thing, just make sure you check your state and find out because federally you will not be liable for not having insurance, but some of these states be playing some games and trying to keep a brother and a sister locked down. So make sure you check your states to see if there are penalties for not having health
Penalties.
insurance
Penalties, fees. And when
because
you
they
do
may
tax
cost you.
returns, that's when it's gonna hit.
Yes. You may want to do that math. You may want to do that math between paying for the insurance versus paying for the penalties.
Please listen to us.
Yes. All right, Feshe, you are amazing. I love this conversation because you just came with a wealth of knowledge. Thank you for laying down the truth and helping us to understand the whole, because insurance can feel so overwhelming sometimes. And a lot of the terms and things are being thrown at people and they don't really have understanding and don't really feel empowered to make insurance decisions. So if they want to tap into your services so that they can find out more about insurance plans and how to navigate and be empowered,
Yep.
how can they tap into your resources?
Absolutely. So we have a website that's www.minematernity.com. We're on Instagram and YouTube. But that would be the best way. So info@mymaternity.com. You can email us, and one of our benefits navigator will be happy to support you, whether that's understanding your insurance, check and doing an insurance check report for you, or helping you pick an insurance, right? What are you eligible for? How do I sign up for different insurance, or maybe even compare insurance? And then if you need reimbursement support, we absolutely can support you. And providers, we definitely have you when it comes to any credentialing process, billing process, and then any consultation. So we're here for you to help our community. Let us help you help them.
I love it. I love it because we be burnt all the way out. We don't have time for this work. Listen,
Yes, you have healing hands. Focus on the healing hands.
It's a saving grace to have someone help us in that way. And if people are trying to process sort of your role, if you go to a financial advisor to help with your finances, this is another aspect of that, right? So it's helping with your finances in regards to your healthcare.
Yes.
So if you invest in financial advisors, you should invest in someone who can help you with your finances when it comes to your healthcare. And I am Dr. T, the hand behind the handle of Healthy Bump Club right here on YouTube and at healthybump.club on Instagram. We thank you guys for watching. Make sure you check out some of our other videos. Pache touching some topics that we also explained in prior topics. So if you want more expansion of finding out what are these healthcare changes coming up, we got you. If you want a topic finding out on how to utilize pelvic floor physical therapy pre and post delivery, we got you. We're going to hook you up with those videos below. And we hope to see you guys when the next episode. And I don't know why I love that part. I love it. I love it. This is Dr. T. Just a friendly reminder. Don't forget to comment, like, and share. And go ahead. Why not? Click that subscribe button. Help us to get to the next 1,000 subscribers. We thank you guys for supporting.